It's a fatal disease that impacts more than 100,000 people in the U.S. each year. September is Pulmonary Fibrosis Awareness Month. Joining me right now is Assistant Professor of Pulmonary Medicine at UTHealth Houston, Dr. Rodeo Abrencillio, to talk more about the disease and how you can limit your risk. Doctor, good morning. Thank you so much for your time.
Good morning. Happy to be here.
Absolutely. Thank you so much. For people not familiar with this disease, what is it and who does it tend to impact most?
So pulmonary fibrosis is a very generic term. Pulmonary means lungs and fibrosis means scar. So it's not really one disease. It's a group of diseases of about maybe we estimate 200 diseases that causes your lung to scar. So for people affected by this disease, it can range from early adulthood to really late in the age group. And you're absolutely right. Some of these diseases can be progressive and can lead to respiratory failure and eventually death in some of the patients.
Because you mentioned this is sort of an umbrella term, if you will, for different types of diseases. Do any of these diseases have treatment plans, have cures to help mitigate the impacts?
Yeah, so definitely. So there is always hope. Unfortunately, our lungs are not like any other organs, like our liver, that can regenerate. Unfortunately, when the lungs become scar, it stays a scar. And you can imagine if you have a finite amount of lung tissue and this pulmonary fibrosis scars progresses, those lung never reverts back to good lung. And when that happens, this scar tissue would not allow gas exchange. And also, it's really hard to take a breath because it's like inflating a balloon that's really thick. The lungs becomes really stiff. Now, the current treatment is geared towards not cure, but slowing down or halting the process of pulmonary fibrosis once it sets in.
With that said, we're identifying the problem here. Talk to us about what people can do to limit their risk, protect themselves from these sorts of diseases.
Right. So depending on what the cause, there are certain preventive measures. Of course, the most common ones that in the United States that causes pulmonary fibrosis are two etiologic factors or two causes. One is connective tissue disease or autoimmune diseases such as rheumatoid arthritis. The preventative measure there is being proactive on identifying symptoms. So you identify the disease early if it's present. The other one is occupational. So that's the second most common cause of pulmonary fibrosis in the United States. And usually OSHA has good guidelines on how to prevent pulmonary fibrosis. As everyone in our community know, asbestos can cause lung disease, and one of them is pulmonary fibrosis. I think the crux of what makes pulmonary fibrosis worse is actually smoking. It's also a risk factor for idiopathic or lung scarring of unknown cause. So stopping smoking at any point in time is good for your lungs, not only for pulmonary fibrosis prevention.
Yeah, I'm so glad you brought up community and environmental. I'm sure you've seen the headlines by now. Our big story for the past 24 hours has been that massive pipeline fire in Deer Park. From your perspective, from your expertise, any concern with this event?
Of course, I'm always concerned about, as you can see, they said it's a cleaner burn. So unless you're burning water, it's going to be water vapor. If it's chemicals, there's going to be burned chemicals there. And for certain susceptible people, such as people living with COPD, asthma, and pulmonary fibrosis, it can aggravate their respiratory symptoms. And so I'm very much concerned about this going on, I think, for almost 24 hours now, and it's affecting our air quality. And people living with lung diseases will feel this. So for those people, I think, listen to your local health advisory. If they're asking you to evacuate. And for people with bad air quality around them, if there's no option to move, I recommend they stay home.
Yeah. And I know for folks, needing and wanting to get back into their homes, it can't come soon enough. And authorities are telling us that will happen once that flame is out, once it's extinguished. But for people who have any sort of condition, a chronic condition, is there a waiting period beyond the time that that fire is ignited that they should return home? Should they give it, say, a few hours for that air quality to become better?
I think it's all about the air quality that we monitor, our health services monitor. Because as one of our anchors said earlier, that, you know, if you have a wind blowing past and quick, they should clear your air. But if you have that, you know, stagnant wind,
air,
it will linger.
Yeah.
So there's really no way for us to tell if the air quality is good, because you go out there, sometimes you smell it, sometimes you don't. And it's incumbent upon our resources in the community to tell us when it's safe to come back.
Okay. Dr. Abrencillio, thank you so much for your time this morning. We do appreciate it.